The flashing lights of the ambulance illuminated the night as it came to a stop at the entrance of the bustling hospital. The doors flew open, and they wheeled in Remi on a stretcher. A kind-looking nurse with blonde hair approached them with a warm smile. "Hello, dear. My name is Anna." She introduced herself before leading them to bed B. With gentle hands and a sense of urgency, they carefully transferred Remi onto the bed as Anna immediately began assessing her condition. She listened intently to her lungs, checking for any signs of distress. As Anna worked, the paramedic gave his report, and she quickly started an IV line in Remi's hand. Meanwhile, a nurse's aide unhooked Remi's oxygen tube from the tank, connected the tube to the central connection, and attached the cardiac monitor electrodes to her chest. The heavy curtain that separated the beds was suddenly pulled aside with a loud swoosh. In its place stood a tall man with thick salt and pepper hair. He swept his gaze across the small cubicle before fixing his attention on Remi. Introducing himself as Dr. Schwarz, he took note of the discarded nebulizer pipe lying on her bed before directing his piercing blue eyes to her face and hands. "Let me listen to your lungs," he said in a no-nonsense tone, holding out his stethoscope. Remi nodded weakly and struggled to sit up, wincing at the sharp pain in her chest. The doctor placed the cold metal against her skin and listened intently to her lungs, his brow furrowing in concern. After a moment, he asked, "How long have you been dealing with asthma?" "Since as far back as I can remember," Remi gasped out between ragged breaths, beads of sweat forming on her forehead. "I take preventative medications and usually use my nebulizer during sudden attacks, but I didn't have any solution, and the inhaler didn't help." The doctor's expression turned sympathetic as he nodded understandingly. "We'll get you taken care of," he assured her before turning to the nurse. "It's my fault," Emily informed the doctor with tears in her eyes. "Remi is staying with me while her parents are in South America with Doctors Without Borders, and I didn't know she was allergic to cats." "It's okay," Dr. Schwarz spoke in a soothing voice. "We'll make her better, but I'm afraid you need to get rid of your cat." "It's not mine, just cat-sitting for a friend, but I'm going to call my other friends right now. I'm sure one of them will take the cat," Emily said and pulled out her cell phone. "I'll be in the waiting room." She flashed a nervous smile at the young girl and hurried out of the room. The doctor turned to the nurse. "Anna, let's give her 125 solumedrol, hook her up for continuous nebulizer, and get a portable chest x-ray as well." The nurse nodded and left the room. The doctor smiled, pulled the curtain that separated Remi's room from bed C, and greeted the patient. "Hi, Conrad, are you ready?" "Yes," sounded a young boy's voice. The doctor stopped for a second, thinking, and then turned back to Remi. "Do you speak German by any chance?" Caught off guard by the unexpected question, Remi hesitated before responding. Despite having learned the language from her nanny since she was a toddler until high school, she decided against admitting it upon seeing the doctor's peculiar expression. "No, but I speak French," she replied. "Never mind, I just thought, because of your last name, Hansen," he mumbled, stepping out of the room and pulling the curtain closed behind him. That was strange. Why did he ask me if I speak German? Perhaps he doesn't want me to know what they're talking about in the next cubicle? Remi wondered, listening to the conversation coming from behind the curtain. "Are you sure you want it done this way?" Dr. Schwarz asked, speaking in German, and continued, "Don't worry, the girl in that bed doesn't understand the language." Remi heard a boy's and an older-sounding man's voices answering, "Yes, we definitely want the treatment." And the older voice continued, "My son is 16, and with cystic fibrosis and rare blood type, finding a cure or donor is close to impossible. He might have a year left, but with your treatment, he could live a full, healthy life."